October is Breast Cancer Awareness Month, and for women who get diagnosed with breast cancer, it can be a life-changing event. But there are other options out there for treatment. Joining me is Dr. Vincent Nip, a plastic surgeon, and the Queen's Medical Center, and Shelby Ogasawara, a breast cancer survivor who also happens to be a good friend of mine and a coworker. Thank you guys for being here. Appreciate it. I know you're nervous, so stop. Just don't be nervous at all. But let's start with you, Dr. Nip. Once a woman is diagnosed with breast cancer, what does that process entail going forward? Because there's a lot of stuff that they're worried about and nervous about.
Yeah, breast cancer, is a multifactorial event, and there's many people involved in it to be able to go over the situations with them. I look at it as a team sport,
okay,
and the coach is really the breast surgeon, and then the quarterback is the patient. And I like to consider myself as one of the players. I think of myself as the bench, the second string place kicker, as you may relate to that. And the other people involved would be medical oncologists and the radiation oncologists.
Clearly a team to get this thing worked out.
It really is, yeah. It's a multidisciplinary approach to a disease process. The other people that are involved are also the pathologists and the radiologists who have diagnosed the cancer. And with that diagnosis and the characteristics of the cancer, then we can move forward in treating the cancer, not only how to treat it, but the order and how it's treated.
Now, there are some women out there that choose to have their breast surgically removed. How do you give them hope and tell them some of their options? How do you help them?
Yeah, so in that consultation, that's where I really earn my keep, and I'm actually the coach, and these patients will come in, giving them the options, giving them hope, giving them emotional support. I like to go over two things with the patient. When the surgery is performed, that is the reconstructive surgery, and how it's performed. So the when part is, do we do it on an immediate basis, right after the mastectomy, or do it at the same time as the mastectomy, or on a delayed basis when we do it sometime after. And it depends on the nature of the treatment modalities as far as when the timing is. And then we go over the ways of reconstruction. That could be through prosthetics, which are implants, through autologous tissue in your own tissue. And lastly, we can use prosthetics as well as your own tissue to do the reconstruction.
Now, Shelby's joined us. She's a survivor, a good friend of mine. I only just recently learned of your situation, but could you just briefly tell our viewers a little bit about your journey and how you were diagnosed with breast cancer?
Sure. So my first ever mammogram, I went in and I was diagnosed with DCIS, which stands for ductal carcinoma in situ. Basically, it's the lowest form of breast cancer. So before starting just typical treatment, I had it removed with a very simple surgery. And before starting standard radiation and hormonal treatment, medication treatment, it was suggested because of my family history to have genetic testing done. And the genetic testing revealed that I did have a gene mutation from my dad, who did pass away from cancer. So based on that, I did a lot of research, spoke to my physicians, and decided to have a mastectomy, both sides, and just, it means the removal of my breast tissue. And then with Dr. Nip, I met Dr. Nip and had reconstructive surgery, and he's been great throughout. He was great throughout the whole process. I mean, he's just the greatest doctor. That's why he's here today. So.
Thank you for sharing. Appreciate that. You talked about being a team. Some of the best team members got to be family and friends. I mean, how important is it for family and friends to support someone like Shelby?
Yeah, and Shelby's been really nice about this. I really appreciate that and appreciate the time being here. But her family was incredible. In my office, there's a seat on the right-hand side of the patient, left-hand side of me, and I like to have family members there, be it a spouse, friend, and having that person there to go through the emotional support as well as the physical support in the post-operative period is very important. There's also a lot of community support out there, too, for those that don't have that family or friend support.
Thank you for being here, Dr. Nip. I have one last question for Shelby. What do you say to women, even men? Because let's face it, men can get breast cancer as well.
Yes.
Somebody out there is afraid of going in and getting tested, afraid of what it might reveal. What do you tell somebody about that, about getting their mammogram?
Don't be afraid. It's better to be safe than sorry, as they always say. And it's a painless procedure to get a mammogram. And it's better if you detect something early than, waiting. And you should know your body as well. I mean, if you feel like anything is not normal, you should go and see your doctor.
Proactive, not reactive, yes?
Definitely.
In this case, that's the better choice, yeah.
Yes.
Thank you guys so much for being here. I appreciate it. And if you're interested in learning more about mammograms and other women's health service issues, visit www.queens.org and click on the Women's Health tab. Thank you guys. Appreciate it.
Thank you.
Thank you so much for sharing your story with us.